Start. Welcome back, students. Now in this video, let's discuss about the cardiac cycle. Okay, see the cardiac cycle, I feel it's the most important topic for the entire cardiology. Without having a proper understanding of the cardiac cycle, you cannot understand the remaining topics like jugular venous pressures, left ventricular pressure volume, loops. Okay, what is the concept of preload, afterload, the murmurs, like systolic murmurs, diastolic murmurs, heart sounds. You cannot understand actually. Okay, so the most important topic in the cardiovascular physiology is to understand the cardiac cycle in detail, point by point. So let me explain all the events with all the possible MCQs slowly. So please be attentive. Guys, now first let's say the entire cardiac cycle is divided into how many phases? Two phases, systole as well as the diastole. Two phases are there. Okay, systolic phase as well as the diastolic phase. Now you tell me one cardiac cycle, let's say, is of how much time? What is the duration of the cardiac cycle? The duration of the cardiac cycle is 0.8 seconds. One cardiac cycle is 0.8 seconds. Now in 0.8 seconds, there is a systole, there will be a systole and there will be a diastole. It's a systole and diastole of what? Which chamber of the heart? It's a systole and diastole of the ventricles. Okay, it's a systole of the ventricles, diastole of the ventricles. So we are mainly talking the cardiac cycle. We are going to discuss about the cardiac cycle in the point of ventricular contraction, ventricular relaxation. Okay, so not about the atria. We will be discussing mainly about the ventricular contraction, ventricular relaxation. So simultaneously, when the ventricle is contracting, atria will be relaxing. Okay, that also we will discuss. But if I am talking about a cardiac cycle, in cardiac cycle, we are seeing the systole of the ventricles and diastole of the ventricles. Systole of the ventricle and diastole of the ventricle is considered as a one cardiac cycle. Okay, so now in systole, there are three subphases present. What are the three subphases? Isovolumetric contraction, rapid ejection phase and slow ejection phase. There are three subphases present, systole. And how many subphases are there in the diastole? See, in the diastole, there are 5 subphases present. Okay, 5 subphases are present. Like protodiastole, isovolumetric relaxation, rapid filling, slow filling and atrial contraction. See, it's the atrial contraction. Here, atrial contraction. Or you can say atrial systole also. See, it's the atrial contraction which is coming in the phase of diastole. This is what I want you to know. So, don't think when atria is contracting, that is like, systole, don't say something like that. Okay, so atrial contraction is a part of diastole. Or you can say atrial contraction is the last phase. It's the last phase of the cardiac cycle. Okay, so totally tell me in how many the entire cardiac cycle is divided into how many subphases? There are 8 subphases present. Okay, there are 8 subphases present. Next thing, out of all these subphases, here itself I am telling you, out of all these subphases in diastole, see, usually some books they don't even mention the protodiastole. They don't even mention the protodiastole and they don't even mention the slow filling phase. So, what are the 3 major subphases in the diastole? The 3 major subphases in the diastole: isovolumetric relaxation, rapid filling and atrial contraction. See, I will be discussing about them, but I am telling you, some books they don't even mention protodiastole and slow filling or reducer filling separately. They mainly mention about these 3 phases. 3 phases in systole and 3 phases in diastole they will mention. Okay. So, having said that, now next point. See, it's a cycle, right? Cardiac cycle. Cycle means what? Cycle means cyclical events. Events will happen again and again. So, these events are going to happen again and again, like cycle like. So, for understanding purpose, let's say something like this, slow ejection phase. Now, tell me what is the next phase that will come after slow ejection phase? See, slow ejection phase is the third phase. After third phase, there will be protodiastole. Okay. So, after following the slow ejection phase, there will be protodiastole. After protodiastole, you know the story. Okay, something like this. So, for easy understanding purpose, now let me start the entire cardiac cycle with the atrial contraction. Okay, atrial contraction. So, you tell me, if I am starting with the atrial contraction, what is the next phase that is going to start? Isovolumetric contraction, because it's a cyclical events, right? These are the cyclical events. Events happens again and again. Okay. So, yes, for easy understanding purpose, now let's begin our topic with the atrial contraction, or you can say atrial systole. Okay. But always remember, atrial contraction is a part of diastole. Okay. So, let me directly show you the 8th subphase here. So, this is atrial contraction. Okay, here I am highlighting atrial contraction. Guys, how to understand this atrial contraction? Before going there, you tell me, what is this? This is the 4th chamber heart. Okay, 4 chambers of the heart, sir. Right atria, left atria. Okay, na? This is right atria, left atria. Right ventricle, left ventricle. What is this blood vessel that is coming out of the right ventricle? The blood vessel which is coming out of the right ventricle, this is a pulmonary artery, let's say. Actually, it's a pulmonary trunk. Later, it will divide into pulmonary arteries. For easy understanding purpose, let's say this is a pulmonary artery which is taking the blood to the lungs. And what is the wall which is present over here? A pulmonic wall. And what is this blood vessel that is coming out of the left ventricle? Here is the aorta. Okay, here is the aorta. And what is this wall? Aortic wall. Here is the aortic wall. Tell me, what is this wall which I am pointing here? The wall which I am pointing here, this is the tricuspid wall, and the wall which I am pointing right now here, this is the mitral wall. Okay, here is the mitral wall. Now these two valves together called as the atrioventricular valves. Okay, they are called as the atrioventricular valves. Atrioventricular valve, because they are separating the atria from the ventricles. And these two valves which I am highlighting downside here. Okay, so these two valves, these bottom valves which I am showing here, they are the semilunar valves. Okay, here they are semilunar valves. Okay, they are the semilunar valves. So semilunar valves include what? The semilunar valves include the aortic valve and pulmonary valve, and the atrioventricular valves, AV valves, includes the tricuspid valve and the mitral valve. Okay. Now wherever I am going to show you the plus symbol, whenever I show the plus symbol indicates contraction. So you tell me, who is contracting now? It's the atria which is contracting. When the atria is contracting, see, can you see the blood is coming down into the ventricles? Yes or no? Yes. These valves are open. Okay, the valves are in the open state. Okay, but the valves are in the open state. They are already open. So because of the atrial contraction, the blood from the atria is going to fall down into the ventricles. How much percentage of the ventricles will fill because of this atrial contraction? How much percentage of the ventricles are going to get filled? Only 30%. Okay, that's why I am showing you here 30%. But already appreciate, there is 70% of the blood in the ventricles. Okay, already 70% of the blood is there in the ventricles. From where this 70% came? I will explain you later. Okay, I will explain you later from where the 70% came. But because of the atrial contraction, the ventricles are going to be getting filled. How much percentage? 30%. Actively or passively? Actively, because the atria is contracting. The muscle is contracting. Energy is utilized. Okay. So now write, this atrial systole or atrial contraction contributes only to 30% filling of the ventricles. Because of this, only 30% of the ventricles are going to get filled. Actively or passively? This happens active. Okay, this is the active filling of the ventricles. Okay, active filling of the ventricles. Because of this 30% filling of the ventricles, when 30% blood hits the ventricular walls, when 30% blood hit the ventricular walls, it's going to create a sound called as S4 heart sound. But can you usually hear this S4 heart sound? No, usually we can't hear the S4 heart sound. What is the regular heart sounds? S1 and S2. These are additional. S3 and S4 are additional. But tell me, this S4 heart sound, can you hear it normally? No. Most of the time it is abnormal. Okay, this is abnormal. S4 is abnormal. Okay. So S4 heart sound is seen during which phase of the cardiac cycle? During atrial contraction. Is it normal? No, abnormal. Then it is heard in which conditions? Which abnormal conditions? Right. First of all, it is abnormal. It is heard in which conditions? It is heard in conditions wherever there is hypertrophy. Okay. There is ventricular hypertrophy. Okay. So in whatever the condition, wherever there is ventricular hypertrophy as well as atrial hypertrophy also, whenever the ventricle is undergoing hypertrophy, usually atria will also undergo hypertrophy. So in the conditions wherever there is ventricular hypertrophy or atrial hypertrophy, you can hear which heart sound? S4 heart sound. Now my question is, in which conditions you will have the ventricular hypertrophy? In which conditions do you think the ventricle, the left ventricle or the right ventricle is undergoing hypertrophy? One of the classical reasons is hypertension. Okay, hypertension. You know, in a patient who is having hypertension, let's say here there is more blood pressure. So here there is more blood pressure in the aorta. In a person who is having more blood pressure in the aorta, arteries or arterioles, in order to push the blood, now left ventricle have to more work. Now the left ventricle have to do more work. There is more workload. So normally, what will happen to the left ventricle? The left ventricle will undergo hypertrophy. Or you can say the left ventricle is becoming stiff. Okay, now it's becoming a stiff ventricle in a patient who is having long-standing hypertension. Okay, in a long-standing hypertension patient, there will be ventricular hypertrophy. Or you can say whenever there is a block here, that is a left ventricular outflow tract obstruction. Whenever there is an obstruction like atrial stenosis, or you can say HOCM, hypertrophic obstructive cardiomyopathy. In hypertrophic obstructive cardiomyopathy, HOCM condition, there will be subaortic stenosis. There is a subaortic stenosis because of the thickened interventricular septum. Okay, so I am telling you in which conditions the patient will have ventricular hypertrophy. Ventricular hypertrophy is seen with long-standing hypertension, or the patient who is having aortic stenosis or hypertrophic obstructive cardiomyopathy. So in these conditions, okay, so ventricular hypertension, aortic stenosis, hypertrophic obstructive cardiomyopathy, in all these conditions, there will be ventricular hypertrophy. Whenever there is ventricular hypertrophy, we can say atria contracting against the, whenever atria contracts against the stiff ventricles, whenever atria contracts against the stiff ventricles, it is going to cause which heart sound? S4 heart sound. So always remember S4 is abnormal. S4 heart sound is seen in which conditions? It is seen in conditions wherever there is ventricular hypertrophy. Okay. And that too, this S4 heart sound, you can hear it with which side of the stethoscope? So it's a first of all low pitch heart sound. So it is heard with bell side of the stethoscope. Okay, S4 heart sound, it is a low pitch heart sound. It's a low pitch heart sound. It is heard with which side of the stethoscope? You know, a stethoscope has a big side which is called as a diaphragm and small side which is called as a bell. So this S4 heart sound, it is heard with bell side of the stethoscope. Okay, it's a low pitch heart sound. Okay, so having said that, the atrial contraction topic completed. Okay, atrial contraction topic completed. Now look at here. See, on this bottom side, I am talking about all the events of the cardiac cycle one by one, one after the other. Okay, actually it is a cycle, but I am just showing in the form of a line diagram. Let's say here I am talking about systolic events and diastolic events. Have I taught you? Right now we are in the diastole. Which phase of the diastole? Last phase of the diastole, that is atrial contraction. So that's why look at here. Here is atrial contraction. Highlight here in your books, atrial contraction. Now, this atrial contraction, during the time of the atrial contraction, have I taught you, there will be an abnormal heart sound that can be heard in some abnormalities, that is S4 heart sound. S4 heart sound can be heard. Tell me, this atrial systole contributes to how much percentage filling of the ventricles? 30% filling. Okay, 30% ventricular filling. Actively or passively? Active. Now, why I am writing it again and again? Because at the end you will have a understanding. Okay, you will have a clarity. So, if you are having these notes, you also write it. Next, after atrial contraction, what is the next phase that you think it's going to come? See, successfully we have completed the atrial contraction. This is completed. Now, after atrial contraction, the next phase that's going to begin is isovolumetric contraction. Isovolumic contraction. We are entering into the systole. So, highlight here, isovolumetric contraction. Now tell me, what exactly happens during the isovolumetric contraction? What do you think? See, in the name itself is there. First of all, iso means what? Iso means same. Volumetric means same volume of blood is there in the ventricles. So, isovolumetric means same volume. Okay, same volume contraction. So, what exactly is happening during same volume or isovolumetric contraction? Let me tell you. Always concentrate on this diagram. Guys, whatever the events that happens on the left side of the heart, same events also happens on the right side of the heart. So, why to discuss twice the time, unnecessary time waste? So, let me mainly concentrate on the left side of the heart. Whatever the events that happens on the left side of the heart, same events will also happen on the right side of the heart. Okay, that's a common thing. Now, listen carefully. Who is contracting? Now, for the first time, ventricle is going to contract. Why ventricle is contracting? Now, you have to tell me, during atrial contraction, how much ventricular filling is happened? 30%. But already how much blood is there? 70% blood already there. So, 70 plus 30 how much? 100%. So, yes, 100% ventricular filling completed. Let's say 100% ventricular filling completed. Okay, no? 100% ventricular filling completed. Now, okay, 100% blood means how much, sir? How much ml? 100% of the ventricles are getting filled. Okay, but how much ml of blood is there in the ventricles? Let's say in the left ventricle and right ventricle, here 120 ml of blood is there. Here also, in this side also 120 ml blood is there. So, this is called as preload or end diastolic volume. So, what does it mean by the word preload? Preload means how much blood you are keeping in the ventricles. Okay, before contraction of the ventricles, first of all, how much blood is there in the ventricles? It will be somewhere around 120 to 140 ml. That is called as a preload or end of the diastolic volume. End diastolic volume. At the end of diastole, how much of the ventricles are filled? 100% ventricle filled. And how much blood is there? 120 ml in both the ventricles. Okay, both the ventricles. Now, see, now listen carefully. What is this blood vessel that I am highlighting? You know, this blood vessel that I have highlighted, it's the aorta. Now, in the aorta, here in the aorta, what is the pressure? The pressure here in the aorta is 80 mmHg. Okay, still heart is not contracting. See, still heart is not contracting. Have you ever heard what is the diastolic blood pressure when the heart is not contracting? That is called as a diastole. During diastole, the blood pressure is 80 mmHg. Systolic by diastolic, 120 by 80, you already know it. So, now what is the blood pressure? The aortic blood pressure is 80 mmHg. Fine. Now, what is the blood pressure in the left ventricle? Let's say. So, the pressure in the left ventricle, is somewhere around 4. Let's say 4 mmHg here. Here is how much pressure? 4 mmHg. Okay, 4 mmHg pressure. Now, tell me, here there is higher pressure, here there is lesser pressure. So, there is a chance that the blood can come back from aorta to ventricle. Do you want that? Do you want the blood to regurgitate back to the ventricles? No, we don't want that. That will lead to heart failure. Okay, aortic regurgitation. We don't want that. So, already here from the beginning, these valves are kept in closed state. From the starting, these valves are closed. They are not closing now. From the beginning, they are in closed state because to prevent the regurgitation. So, you tell me what we have to do. Sir, here 120 ml of blood is there. So, we need to open this aortic valve. We need to open this aortic valve on the left side and we have to push this blood. We have to push the blood into aorta. So, in order to do that, in order to open this aortic valve, you have to raise the pressure in the ventricle. You have to raise the pressure from 4 mmHg to 81 mmHg. Okay, if you increase the pressure to 81 mmHg, the aortic valve is going to open. So, blood will be ejecting. Okay, the blood will be ejecting into aorta. Okay, the blood will be ejecting into aorta. So, now tell me what is the purpose of this isovolumetric contraction? The purpose of the isovolumetric contraction is to increase the pressure from 4 to 81. So, you have to contract the ventricle. So, the pressure is going to rise from 4 to 81 mmHg. Once the pressure here is 81 mmHg, the aortic valve is going to open. Once the aortic valves are opened, the blood will start to eject into aorta. Okay, but tell me, one problem is there here. What is the problem? The problem is when the ventricle is contracting, there is a chance the blood can go back into atria. Do you want this regurgitation of blood to back into atria? No, we don't want that. So, in order to prevent this regurgitation, immediately which valve closed? Mitral valve closed, tricuspid valve closed. So, the moment ventricles start to contract, in the beginning of the ventricular contraction, listen carefully. In the beginning of the ventricular contraction, see, ventricle just start to contract. So, there is slight increase in pressure. This pressure is going to close this mitral valve and a tricuspid valve. First, the mitral valve is going to close. Within a fraction of a second, tricuspid valve also closes. So, now you tell me, so just now the mitral and tricuspid valves closed. From the beginning, the aortic valve and pulmonic valve, they are in the closed state. From the beginning itself, they are in closed state. So, all 4 valves are closed. All 4 valves are in closed state. So, nothing comes into the ventricle, nothing goes out of the ventricle. So, that's why the word isovolumetric. Isovolumetric means the volume of blood within the ventricle is not changing. The amount of blood in the ventricle is not changing. It is just 120 ml. Just 120 ml. It is not increasing, rather decreasing. Because nothing comes in, nothing goes out. Because all the 4 valves in the heart are in closed state. So, always remember, whenever you see this word isovolumetric, okay, whenever you see this word isovolumetric, all 4 valves are in closed state. Okay, all the 4 valves in the closed state. Okay, the volume of blood in the ventricle is not changing. Now, my dear students, you tell me, the closure of this atrioventricular valves, that is the mitral valve and tricuspid valve, is going to cause which heart sound? S1 heart sound. The closure of the mitral and tricuspid valve causes S1 heart sound. So, in this diagram, according to this diagram, always remember, the closure of this above valves causes S1 heart sound. Okay, later I will tell you, the closure of this bottom valves causes S2 heart sound. Okay. Now, students, let's see all these events one by one in this para. Okay, there is a paragraph, right? Okay, we can see all these things, all these points one by one. See, students, in isovolumetric contraction, the purpose of this isovolumetric contraction is to open the aortic valve on the left side and pulmonic valve on the right side. So, aortic valve has to open on the right side, the pulmonic valve has to open. Okay, on the left side the blood has to enter into the aorta, on the left side the blood has to enter into the pulmonary artery. Next, the rise in ventricular pressure. See, the beginning of the ventricular contraction, the rise in the ventricular pressure immediately causes that mitral valve and tricuspid valve to close. Okay, so causes the mitral and tricuspid valves to close. That results in which heart sound? S1 heart sound. Okay, now you tell me, ventricle is contracting. The pressure is rising from 4 to 4, 10, 50, 80, 81. Now you tell me, the moment the pressure here it is 81, the moment here the pressure is 81, let's say, immediately which valve is going to open? Aortic valve is going to open. The moment aortic valve is opened, now can you call it as isovolumetric contraction? No, isovolumetric contraction is completed because during isovolumetric contraction, all 4 valves in the heart are in closed state. Now you can no longer call it as isovolumetric contraction. Okay, so now tell me, isovolumetric contraction ends with opening of aortic valve and pulmonic valve. So the moment these valves are opened, isovolumetric contraction completed. You tell me, the moment these valves are opened, the blood will be ejected into aorta. The ejection of blood will cause a heart sound called as ejection clicks. Okay, ejection clicks. So ejection clicks are seen during the systole, sir. Okay, so listen carefully. Once the pressure rises above 80 mmHg, aortic valve open. So how do I know that aortic valve is opened? By hearing which sound? Ejection click. So ejection click is heard in certain conditions that we will discuss later. Okay, so ejection clicks, loud ejection clicks are heard in certain pathologies that we will discuss later anyway. So, but point is, ejection click is due to opening of the aortic valve. Once aortic valve is opened, the blood is ejected into the aorta, that is causing the sound. So the moment you hear the ejection click, the isovolumetric contraction is completed. Okay, so let's see the same thing again here in the line diagram. We are talking about the systole. In the systole, the first phase is called as the isovolumetric contraction. Here in the isovolumetric contraction, the pressure is going to rise from 4 mmHg to 81 mmHg, 4 mmHg to 81 mmHg. Okay, so have I told you in the beginning of the isovolumetric contraction which heart sound is heard? S1 heart sound is heard due to the closure of the mitral and tricuspid valve. First mitral valve closes, later tricuspid valve closes. Next, the moment the pressure reaches 81 mmHg, the aortic valve is going to open and the pulmonic valve is going to open, which is going to cause which heart sound? Ejection clicks, ejection click. Now this ejection click, right, it is due to, ejection click is due to opening of aortic and pulmonic valve. It is due to opening of the aortic valve and pulmonic valve. Done. Now after this isovolumetric contraction, now let's go into the next phases, that is the rapid ejection phase and slow ejection phase. Let's go back to our flow chart. See, now isovolumetric contraction topic completed. After isovolumetric contraction, the next two phases that I am going to discuss simultaneously, that is rapid ejection phase and slow ejection phases. Two phases I will discuss together. Now look at this next diagram. Here I am discussing about rapid ejection phase and slow ejection phases. Now what is happening during a rapid ejection phase? Listen guys carefully. Just now I have told you the pressure here in the ventricle reaches 81 mmHg, let's say. Which valve is going to open? Aortic valve opened. Once the aortic valve is opened, which heart sound is heard? Ejection click is heard. Okay. But your ventricle is not satisfied with 81 mmHg pressure. See guys, the one point which I want you to know, opening of this valve is not enough. Do you think once this valve is opened, do you think blood will immediately go into aorta? No, the blood is not going to go into aorta. Okay, just opening of this valve is not sufficient. You have to increase the pressure here. Still ventricle is contracting. So the ventricular pressure is reaching from 81 to 120 mmHg. Okay. So guys, remember first the big part of the ventricle, the chunk of the ventricle. See, let's say ventricle is like this. When the apex of the ventricle is contracting, first the apex will contract, later the base will contract. Apex is made up of big muscles, thick muscle. Okay, lot of muscle is there. Because the apex of the ventricle is contracting, the pressure is going to reach from 81 mmHg to 120 mmHg pressure. Okay, so here this is rising in pressure. So what do you think when the pressure is rising from 81 to 120? There is increasing in the pressure. Whenever there is increasing in the pressure, what do you think? Do you think blood will go into the aorta with more velocity or less velocity? The blood will go into aorta with more velocity. More velocity, that is called as a rapid ejection. The blood is ejecting into the aorta rapidly. Why rapidly? Because the pressure in the left ventricle is increasing. The more the pressure, with more velocity, the blood is leaving the left ventricle. The blood is leaving the left ventricle or entering into the aorta. That's why rapid ejection phase. Okay. Now after the apical contraction, now which part of the ventricle is going to contract? The base of the ventricle is going to contract. So which means still we are in systole. Now the base of the ventricle is going to contract. When the base of the ventricle is contracting, see, it's made up of thin muscles, so less pressures. So actually pressures are going to decrease from 120 to back to 80. So pressures are decreasing, declining. Okay. So now tell me, when the pressure is decreasing here, what do you think? Blood will go out with more velocity or less velocity? The blood will start to go out with less velocity. So that's why it is called as slow ejection phase. So first the blood is going to eject into aorta rapidly, later slowly. So first fast movement, later slow movement, that is called as the rapid ejection phase and slow ejection phase. Rapid ejection phase is due to the contraction of the apex of the ventricle, and slow ejection phase is due to the contraction of the base of the ventricles. Okay. Now, my question, tell me, sir, during this phase, pressure is increasing or decreasing? Pressure is increasing or decreasing? Yeah, pressure is decreasing, sir. During this phase, ventricle is contracting or relaxing? Still contracting. Listen, during slow ejection phase, yeah, still ventricle is contracting. But you might ask me, why the pressure is decreasing then? Because it's thin part of the ventricle contracting, very less amount of muscles are contracting. So that's why pressure is decreasing. So now let's highlight here. During rapid ejection phase, the pressure is going to increase from 81 to 120 mmHg. Okay. So more blood is going to be ejected. Rapidly the blood is going to be ejected. More blood will go and high velocity also. During slow ejection phase, the pressure is going to decrease from 122 back to 80. So less blood will go with less velocity. Okay. So right here, two-third of stroke volume will be ejected. Two-third of stroke volume is ejected. Here only one-third of SV stroke volume ejected. Okay, two-third of stroke volume ejected, one-third of stroke volume ejected. See, now you will be having a doubt, sir, what is the stroke volume? I don't know. I only know about the preload, sir, 120 ml, you know. Sir, right, one by one here. Tell me, what is preload? Preload is also called as end diastolic volume. How much is the value? 120 ml. 120 to 140 is the range. Now, I am asking, you are filling the ventricle 120 ml. Okay, 120 ml of blood is there in the ventricles. What do you think? When a ventricle is contracting, okay, when a ventricle is contracting, do you think all this 120 ml enters into aorta from the left ventricle? No, it's not possible. So, how much blood will be ejected with one heartbeat? See, with one heartbeat, how much blood is ejected into aorta? Out of 120, how much is ejected? That is called as a stroke volume. So, stroke volume, what is the answer? Stroke volume will be 70 ml. Okay, 70 ml. Okay, so 70 to 90 ml. The range can be 70 ml to 90 ml. Okay, end diastolic volume also 120 ml to 140 ml. I am just taking the least values, let's say 120 ml. Stroke volume is 70 ml. Okay, stroke volume is 70 ml. Okay, now out of 120, how much is actually going into the aorta? Only 70. Only 70 is going. So then what? How much is left over in the ventricle? So even after systole, see, even after systole, some blood is still left over because out of 120, only 70 left into the aorta. But how much is still present in the left ventricle? So that is called as end systolic volume. End systolic volume. End systolic volume will be how much? 120 minus 70, 50 ml. 50 ml, let's say. Okay, 50 ml. This is the end systolic volume. Now I am asking to know how good the heart is working. What is the best parameter? See, out of 120 ml, how much actually went into the aorta? 70 ml. So this is stroke volume divided by end diastolic volume. So always the value will be more than 55%. Usually it will be somewhere around 55 to like 70% also. Okay. So this is called as ejection fraction. Okay. So tell me, what is EF, ejection fraction? Ejection fraction, the formula is stroke volume divided by end diastolic volume. Okay, stroke volume divided by end diastolic volume. Okay, done. So what is the ejection fraction? Usually the ejection fraction is greater than 55%. Okay, so it will tell you how good the heart is working. Okay, always remember, more than 55% of the blood will be ejected into the aorta. Now, how to calculate the cardiac output? Here itself I am telling you how to calculate the cardiac output. Cardiac output is equal to, you know, the formula is stroke volume into heart rate. Okay, you know the stroke volume value and you know the heart rate. So stroke volume how much? 70 ml into heart rate. How many times your heart is going to beat in a minute? 72 times. So 70 into 72 will be somewhere around 5 liters. So your cardiac output is 5 liters, means every minute your heart is going to pump how much amount of blood? 5 liters of blood. Okay. If you are really good student, try to answer this. End diastolic volume minus end systolic volume will tell you about what? How much is end diastolic volume? 120 ml. How much is end systolic volume? 50 ml. 120 minus 50 how much? 70 ml. So what is this? This is nothing but your stroke volume. So end diastolic volume minus end systolic volume will tell you about the stroke volume. Okay, with one heartbeat, how much blood is ejected into aorta? That is the stroke volume. Okay. Now my question to you at the end of the day, sir, stroke volume is maximally ejected during which phase of the cardiac cycle? Okay, blood is going into aorta, but in which phase? Maximum blood will go into aorta during which phase? Rapid ejection phase. So that's why I have written here two-third 2/3 means 66 percentage. 2/3 of the stroke volume, 2/3 of the stroke volume is ejected during the rapid ejection phase. Only 1/3 of the stroke volume is ejected during slow ejection phase. Okay. But if I ask you, how much blood is ejected or how much stroke volume is ejected during isovolumetric contraction? Okay. Usually students, let me ask you something like this. Students have a mindset like whenever heart contracts, blood will be ejected into aorta. Whenever ventricle contracts, blood will be ejected into aorta. But it's not always true. Tell me, during isovolumetric contraction, listen, during isovolumetric contraction, the ventricle is contracting. But do you think even a single drop of blood is going into aorta? No, because all 4 valves are closed. During isovolumetric contraction, all 4 valves are closed. Nothing comes in, nothing goes out. So tell me, how much stroke volume is ejected during isovolumetric contraction? 0. Stroke volume is not ejected because the aortic valve is closed, so nothing is going out, so stroke volume is not getting ejected. Okay. So having said that, now let's come to the timeline diagram. So in the timeline diagram, here I am highlighting rapid ejection phase. Okay, rapid ejection phase. See, in the rapid ejection phase, the pressure is going to rise from 81 mmHg to 120 mmHg. The pressure is rising. As the pressure is rising, more blood will be ejected into the aorta. How much blood? 2/3 of SV ejected. 2/3 of the stroke volume ejected. Next, what about the slow ejection phase? During slow ejection phase, the base of the ventricle is contracting, so the pressure is going to decrease from 120. The pressure is going to decrease back to 80. Let's say. So now, as the pressure is decreasing, less amount of blood will be ejected. Only 1/3 of stroke volume ejected. Okay, 1/3 of stroke volume will be ejected. So that's it. So here on bottom side, I am representing about the pressure changes. See, in the beginning, the pressure will go from 4 to 81. During rapid ejection phase, the pressure is going to rise from 81 to 120. During slow ejection phase, pressure is going to fall from 122 back to 80. Okay, done. So with this, successfully what we have completed the systole. Systole, that is isovolumetric contraction, rapid ejection phases and slow ejection phases. We have completed the systole. Now, in the next video, okay, otherwise it will be lengthy. In the next video, I will be discussing about the phases of the diastole. Okay, what are the 5 phases of the diastole? What is happening? Which valves are going to open? Which valves are going to close? That we will discuss in the next video. Okay, cardiac cycle part 2. Thank you.